In AML, I think that the prolonging of remission is also related to the novel agents that we are going to use. We are going to introduce in our clinical practice many drugs, particularly balanced on the molecular status of our patients. So I think that at first, today we need to really invest on the molecular characterization of our patients. We need to understand which is the expression of molecular biomarkers for our AML patients and to understand which is the optimal drugs, optimal combination according to that. In particular, the rule of maintenance in AML is something that is more and more emerging and more and more consolidating. We know the exciting data with the methylating agents that have taken to the approvals of these drugs, particularly azacitidine. I think that also other potential inhibitors, other drugs are going to be integrated in maintenance also in our current clinical practice. But I think that also the idea of continuous treatment that we are going to start also in a strong to treat disease like AML is something that is revolutionizing the outcome of our patients. So the idea to not stop the treatment in the moment of allogeneic stem cell transplantation, continuing with only the supportive care, but the idea of maintaining the response with a balanced dose dense and dose intensity, but with a accurate inhibition of the related pathways that take in life the disease is something that will help us to cure as much patient as possible. So I think that the next future is more and more enthusiastic, and after many years of lacking of results, we are going to explore a wonderful world also for acute myeloid leukemia patient, and this is the best wish to achieve as many cures as possible for this particular difficult setting.